Hello, welcome everyone. I'm Dawn Argula, CEO and President of the Livermore Valley Chamber of Commerce. Thank you everyone for joining us today for the healthcare series with Stanford ValleyCare that the Tri-Valley Chambers of Commerce have been presenting over the last few months. This is the final one in the series, and today's topic is preventing and recognizing skin cancer, tips and strategies to care for your skin. We are embarking upon our summer hot season. So this is a really appropriate topic for us to cover today, keeping ourselves and our workforce safe during the summer season. And today with me, I have Dr. Meghan Dickman, who is the Clinical Associate Professor of Dermatology and Medical Director of Dermatology at Stanford ValleyCare Healthcare. Dr. Dickman earned her BS with distinction from the University of Michigan in 2006. She received her medical degree from the University of California, San Francisco, and she has a distinguished background during her educational time. During medical school, Dr. Dickman was inducted into the Alpha Omega Alpha Honor Medical Society. She completed her dermatology residency at Stanford University and served as chief resident in her final year. She is board certified in dermatology by the American Board of Dermatology, and her professional focus is general medical dermatology, including acne, psoriasis, skin cancer, and dermatologic surgery. And she also has a special interest in patient access and community outreach, as well as medical education. Welcome, Dr. Dickman. And also joining us today, we have Shelby Sawanga, who is the Manager of Marketing, Public Relations, and Volunteer Services at Stanford ValleyCare, who is providing some support to us today. And then also, I would like to recognize my chamber's CEOs from the Tri-Valley, and that is Inga Houston with the Dublin Chamber of Commerce. They're out there in the webinar participant universe, so raise your virtual hand. We have Stuart Bambino with the San Ramon Chamber of Commerce, and Judy Lloyd with the Danville Chamber of Commerce, and James Cooper, our newest CEO to the Tri-Valley Chambers with the Pleasanton Chamber of Commerce. So welcome everyone for joining us today. And with that, I think Dr. Dickman, are you ready to get started?
Sounds great. Thanks for the warm introduction, and I'm happy to be here. So I'm going to go ahead and share my screen.
And also, if your comments or questions that you have throughout Dr. Dickman's presentation, go ahead and enter them into the Q&A, and then we'll follow up on those when she finishes her presentation.
Yeah, absolutely. Just share your comments in the chat and I'll try to get to them. Just confirming that everyone can see the screen now.
Yes.
Okay, good. All right, so I'm going to be talking primarily about recognizing some of what I call the big three skin cancers: basal cell carcinoma, squamous cell carcinoma, and melanoma. These are the most common types of skin cancer that I see in my practice, but I'm also going to talk a bit about prevention and strategies and things that you can do to protect yourself and your family members from skin cancer. So, and then at the end, we'll do a little bit of time for Q&A and a little quiz to see if you're paying attention. So, all right, I'm going to go ahead and get started. So, like I said, the objectives are to recognize these common skin cancers, as well as some red flag signs that should prompt you to seek medical attention if you see something on your own skin. We're going to talk about ways to care for and protect your skin, and leave some time for Q&A at the end. Okay, so first I was going to talk about basal cell carcinoma. This is by far and away the most common type of cancer in the world, and about 2 million people are diagnosed with it annually in the United States. This type of skin cancer is slow growing. It is unlikely to metastasize or to spread other areas, and it's extremely treatable when it's caught early, but it's often on very sun-exposed areas like the face, so it can be cosmetically troubling and disfiguring if it invades into deeper tissues. This is most common in fairer skin types. And the biggest risk factor for this type of skin cancer are those intermittent high intensity sunburns, especially blistering burns. So a very common story is someone says, I went on a skiing trip when I was younger and I didn't wear sunscreen, and oh man, I got so sunburned. Or, I was out water skiing, things like that. Those high intensity bouts of UV exposure are really quite a big risk factor for this type of skin cancer. Some warning signs, and I'm going to show you some pictures in a minute. So just FYI, if you are squeamish about photos, you'll want to be aware of that. But warning signs for this type of skin cancer, oftentimes this can look almost like a pimple that just doesn't go away, kind of just a small pink bump that is persistent. And then especially if you notice it growing with time, that's certainly a red flag. It can also sometimes look like a scar, but you might not remember any history of trauma to that area. And then as the cancer progresses, it can bleed very easily, like with washing your face, and it can be kind of scaly and irritated. Here are some common pictures of basal cell carcinoma. So you can see this photo on the upper left-hand side. It's showing this kind of scar-like presentation. Looks like, this person had some sort of trauma to the skin, but that's just the way that the tumor has infiltrated into the skin. That's how it presents. The photo on the nose is just showing that small pink papule. And then this photo near the ear, this person has a lot of scaly sort of sun damaged cells in other areas, but this area that is marked out with this purple marking pen, that's what we use prior to a biopsy. So that's not part of the tumor, but that is encircling this kind of scaly eroded papule that's consistent with basal cell carcinoma. The next most common type of skin cancer that I see is something called squamous cell carcinoma, or SCC. And this type of skin cancer is often preceded by these precancerous changes, which are called actinic keratoses. These bumps are very, very common. And I always tell patients they feel like sandpaper. So they have a really fine grit to them. If you rub your hands over your forehead, it should feel nice and smooth. But somebody will come in and they'll say, gosh, there's just this one small area, and it doesn't matter how much lotion or moisturizer I put onto it, it always feels just kind of dry and gritty. These are precancerous changes within the skin. And when those precancerous changes are caught early, they're very treatable without surgical intervention. But if they're left untreated, they can continue to progress and turn into typically squamous cell carcinoma. This is a higher risk type of skin cancer than basal cell carcinoma, but it is still very treatable when it's caught early. This again is more common in fair skin types, although I have seen SCC in all types of skin. So increasing amount of pigment or color in your skin doesn't necessarily protect you. In contrast to basal cell carcinoma, the biggest risk factor for squamous cell carcinoma is more long-term accumulation of sun damage. So these are people who may work in high-risk professions outside, police officers, teachers, people who work at nurseries or agricultural workers who spend lots of time outside, lifeguarding, that sort of thing. Tanning beds are a big risk factor for SCC, as well as certain viruses like HPV, which can cause warts. That is also a risk factor for certain types of SCC. This often presents as a kind of scaly spot. It's dry and crusty. Like I said, no matter how much lotion I apply, it's just so dry. It can sometimes be a kind of dome-shaped nodule, and sometimes it can actually look like a horn or a growth that's protruding from the skin. In contrast to basal cell carcinoma, SCC oftentimes can be painful, especially with downward pressure onto the bump. And again, it exhibits easy bleeding. So I'm going to show you some photos now. These are various presentations. So you can see this photo on the upper left-hand side is this kind of protuberant horn from the skin. This is relatively advanced, and I hope that if you saw this growing on your own skin, you would have come to see me or another person sooner than it getting to this spot. But oftentimes it presents as it does on this lower left-hand corner, which some people might confuse for eczema or ringworm. So sometimes there can be an overlapping presentation and it can be challenging to tell. But especially if something isn't responding the way you think it should. Oh, I thought this was ringworm, but I've been applying an antifungal cream to it for the past 3 months and it hasn't budged. That's not typical for ringworm. So then those sorts of things deserve further investigation. SCC is unfortunately not that uncommon on the lower lip. The lower lip is an area that gets a tremendous amount of sun exposure. There's actually a colloquial name for it called farmer's lip, where you can develop precancerous or cancerous changes within the lip. And even if you're good about putting sunscreen on your skin, most of us are not quite as diligent about protecting our lips. If you wear lipstick, that actually the pigment in lipstick might provide you some benefit, but they do sell sunscreen-based chapsticks that you can wear to protect your lips just as you protect your skin. And you can put sunscreen on your lips, but then you have to think about ingestion and all of that thing. So I think the chapsticks are going to be a little bit stickier and better for this mucosal site. These are some photos of the actinic keratoses, which are kind of precursors to squamous cell carcinoma. You can see in this photo on the left, you can imagine if you were to rub your fingers over that skin, it's going to be just kind of rough and bumpy and gritty. Same thing with the photo on the bottom, and the photo, I apologize, on the upper right is a bit blurry. There's some crusted areas behind the ear there that are not coming out very well in this photo. The third type of skin cancer in the big three is the one that we worry about most. So melanoma is by definitely a higher risk category than either basal cell or squamous cell carcinoma. This often presents, someone says, I have a new mole and this one looks bizarre. It looks different from everything else on my body. We call that the ugly duckling sign, and that is definitely a red flag. So typically when people make moles, they make a family of moles that all have similar features. And if you see something that just looks different, it just looks odd when you compare it to all the other growths on your skin, that can be a red flag. Melanoma is more common with advanced age, so in those over age 50, and it is also more common in those with a high density of moles. So there's typically a familial predisposition to the number of moles that you make, and if you have more than 50, that does increase your risk. It's also more common in those with atypical moles, and I'm going to go over what atypical moles mean. Melanoma is a tricky beast. It oftentimes happens in sun-exposed skin, but I have unfortunately seen melanoma in areas that are not getting sun. I've seen it on the soles of the feet. I've seen it on the genitals, sometimes on the scalp under a dense crop of hair. So it doesn't always follow where we think we should be looking for skin cancer, and that's why it's always important. I always ask patients to take off their socks for your skin exam, because I can only assess the skin that I can see. And unfortunately, melanoma can show up in places where you might not expect. There are common risk factors for melanoma. Again, fair skin, more common in that population. Excessive sun exposure, more common in that population. Tanning bed use, current or past. Fortunately, nowadays, there are more legal regulations around tanning beds being regulated as carcinogenic, often in the same way that cigarettes are. And California is having more strict rules around that. So that's been a welcome change. But, for a lot of us who maybe practice riskier behaviors in our youth, those regulations weren't necessarily in place then. And even one tanning bed use can increase your risk of melanoma. There are warning signs for melanoma. You may have heard about the A, B, C, D, E's. And I'll go over some photos to show you what these mean in more detail, but this is an acronym for asymmetric. B is for an irregular border. C is for variable color. D is a diameter greater than 6 millimeters. That's the size of a pencil eraser. Vast majority of moles are going to be smaller than a pencil eraser, although not always. And then E stands for evolution. So anything that you notice changing or blossoming before your eyes. The spot's been there forever. It was always really small, but in the last 6 months, I've just noticed it kind of flourishing. That can be a red flag. So here are some helpful photos that I took from the American Academy of Dermatology website. You can see that for asymmetry, if you bisect this lesion from top to bottom and split it in half, the left half looks very different than the right half. This has reds, it has browns, it has multiple pinpoint areas of dark pigmentation. So this is certainly asymmetric and worrisome. B is for border. We want the border to be nice and crisp. You want to be able to take a Sharpie and draw a line right around the border of this. This border is scalloped in places. It's not a nice uniform circle. There are also areas where the border looks smudged and it sort of splays out into the rest of the skin. That's a red flag. C is for color. So again, we want spots to be uniformly one color, uniformly light brown, medium brown, dark brown, sometimes uniformly pink or uniformly skin colored. But if something has multiple colors in it, dark browns, jet black, or kind of a bluish undertone, areas of depigmentation, you can see in the center, there's this area where it seems to be that there's no pigment or color there. Looks like normal skin. That also is extremely irregular and should raise concern if you ever see this on someone. Again, D is for diameter, so larger than 6 millimeters is atypical. And then E is for evolving. This, you can monitor this changing lesion. You see it starts as a small speck, a little bit larger, now becoming asymmetric with irregular borders. That smudged border on the left hand side at about 7 o'clock and becoming larger with multiple colors in it. So we don't like to see that evolution. Moles should be static. They should be static in size, color, all of that. Okay, I'm gonna switch from talking about what skin cancers look like to talking a little bit more about sun protection and what you can do for your overall skin health, especially during these hot summer months. So when I see a new patient and I am assessing their risk for skin cancer, there are a number of things that I want to know, that I'm using, and it's a calculator in my mind to see, how worried do I need to be about this person. So I want to know if you've had risky behaviors. Do you use tanning beds, especially in your youth before age 25? I want to know if you have any first-degree relatives with melanoma. If you do, that unfortunately does increase your risk of skin cancer, or of melanoma in particular. People always ask me, well, my mom has had a bunch of skin cancers, but no melanomas. And other than the fact that you share the same propensity for fair skin or fair eyes, and potentially have the same risk behaviors when it comes to sun exposure, other cancers, except in rare genetic instances, are not as genetically linked as melanoma. So that's the one that you really want to understand your family history so you can know your own risk. If you have fair skin, fair eyes, and then red hair is also a risk factor. My son has red hair, and people with red hair make a different type of melanin. Melanin is the pigment in your skin that provides color and protects your cells from UV radiation. And people with red hair make a different variant of melanoma that is not as protective. So even compared to people with bleach blonde hair, you take two people, one bleach blonde, one red hair, they get the same amount of exposure, they have the same risk factors. that red-haired person is going to have a higher risk for developing skin cancer throughout their life. Do you have a high density of moles? And then, like I said, we were talking a little bit about atypical moles. So the things that I consider atypical, is it large in size, larger than that 6 millimeter pencil eraser cutoff? You have moles that are odd shapes. You know, they should have that nice crisp border. They should be either uniformly circle or sometimes ovoid. Do you have multiple dermoscopic patterns? I have this handy tool called a dermatoscope, which is a little handheld light microscope that I can use to evaluate moles and see more detail. And we look for specific patterns in moles. There are certain patterns that are more associated with benign growths and other patterns that are more associated with malignant growths. So we want to look for those patterns to help reassure us or raise our concern that this needs to be investigated. And do you have immunosuppression? So nowadays, there are a lot of different types of immunosuppression. The one that tends to be the most pertinent for skin cancer risk is patients who have had a prior transplant. So kidney, heart, liver, lung transplants. Those patients are on heavy duty immunosuppression to protect their new organ from rejection. Unfortunately, in doing that protection, those medications also increase your risk for skin cancer by decreasing what we call immune surveillance in the skin. So you always have these scavenging molecules that are looking for changes or sun damage, evidence of sun damage in your DNA, and then they snip it and they repair it. But being on those medications can reduce your body's ability to do that. There are other types of immunosuppression, like a history of chemotherapy or radiation. Certain genetic syndromes may put you at risk, especially, immune-related genetic syndromes that make you more prone to infections or other things. And then patients who have IBD, like irritable bowel disease. So this would be Crohn's or ulcerative colitis, or patients with rheumatologic diseases like rheumatoid arthritis. These patients are often on a class of medications called biologics that can be very helpful for these autoimmune conditions, but they do increase your risk for skin cancer by that immunosuppression that they provide. And I want to know about your own practices that may increase or decrease your risk of UV radiation. Did you have lots of those blistering burns in your youth? Did you work outside? Were you a lifeguard, or do you work in agriculture? Are you a farmer and you're out in your field every day? So I want to know all of those things that raise or lower your risk. And as with most cancers, risk does increase with increasing age. In terms of prevention, the number 1, 2, and 3 thing that you can do is wear sunscreen. I tell patients that wearing sunscreen is like brushing your teeth. It should be a daily part of your routine. Fortunately, nowadays, there are lots of daily facial moisturizers that have sunscreen built into them. So you don't need to apply a second step to your skin every day when you put on your wash your face and put on your moisturizer before you go into work. You can just make sure that your moisturizer has sunscreen in it. People sometimes ask me, what about sunscreen in my makeup? Or I wear a powder that has sunscreen. I think it's a good idea in theory, but unfortunately it's not providing enough protection, because the amount that you need to get on there is not the amount that you're applying via makeup. Ideally, you want to wear SPF 30 or higher. I need a new picture here because it says SPF 15, but we really like to see 30 or higher. And then if you're going to the beach for the day, you're going out for a hike or out to lunch with a friend, and you're going to have, hours of exposure, you want to push up to 50 or higher. It does not have to be expensive. I think in general, people spend way too much money on their skincare regimens, and it does not have to be fancy or expensive. You can get the CVS brand. You want to look for 2 things on the bottle. It should be SPF 30 or higher, and it should say broad spectrum on the bottle. It has to meet a set of FDA requirements in order to list that on the label. Okay. And then the most important thing, and I am as guilty of this as anyone, is reapplication. This is where most of us really struggle. Even in the best of situations, which is no sweat, no swimming, sunscreen lasts 2 hours. So it's great if you put it on every morning as your moisturizer. Put it on at 9 a.m., go into work. Maybe you go grab a coffee after lunch. Well, when you're walking down the street, there's really not anything left there. So you do have to reapply. And that's why I really like sun protective clothing, because it does not rub off and it gives you an added layer of benefit. There has been lots in the lay press in recent years about sunscreen and concerns about sunscreen, whether or not it's safe. And I think that this is a really interesting area that frankly needs more time to understand the risks that may or may not be there. A lot of the concern has been primarily twofold. Number one has been over environmental concerns with certain chemical filters. There have been some states like Hawaii and certain, I think Miami passed a law recently. So there's certain jurisdictions where they have outlawed certain chemical filters. The one we worry about most is something called oxybenzone. Those filters have been shown at high doses to bleach coral reefs. So if you get a million tourists snorkeling in Hawaii, that's a lot of sunscreen to pour into the water there. And so that's been one concern, is environmentally. The second concern has been absorption into the skin. And that happens with chemical sunscreens, not physical sunscreens. So I'm going to talk a little bit about the difference and when you're looking at your own sunscreen options, what that might mean for you. So chemical filters, these are ones that have names that are sometimes difficult to pronounce. When you turn the back of the bottle over on any sunscreen, it's going to say active ingredients. Chemical filters are things like avobenzone, octocrylene, oxybenzone, octinoxate. They have long words, long names that are difficult to pronounce. If you buy sunscreen in Canada or Europe, they have a superior filter called Pinazord. It's not been approved by the FDA, although it's been widely used in Canada and Europe for almost 20 years now. And is a very, very good filter, but those are chemical filters. Chemical sunscreens, the way they protect your skin from UV radiation is that they absorb UV light and they transfer it to a lower wavelength that cannot penetrate your DNA and cause those changes that are seen with sun exposure. So these do melt into the skin to provide protection. This is in contrast to physical blockers. The other name for physical blocker is a mineral sunscreen. Mineral sunscreens, there are only two mineral filters that are approved in the United States, and that is zinc oxide and titanium dioxide. So when you flip the back of the bottle over and you see zinc and titanium, if there's any other name there, it is a chemical sunscreen. Physical blockers can only have zinc and titanium listed as active ingredients. I always recommend physical blockers for children because of the potential theoretic risk of chemical filters absorbing into the skin. The way that physical blockers work is, instead of that transitioning the UV radiation to a lower wavelength, what they do is they act as a shield. So they lay on top of the skin and they reflect back out UV radiation. So it bounces back out into the atmosphere. This is also why these sunscreens, there's a savvy marketing name that zinc and titanium are not as cosmetically elegant. So they may provide that kind of white cast or white sheen to your skin. And that can be cosmetically bothersome, particularly for skin of color patients, because it really can give you that kind of pasty appearance. You know, the classic zinc oxide nose on the lifeguard from 50 years ago. They're better than they once were, but they are not as sophisticated in terms of their gloss as the chemical filters. And then last thing I will say is that sunscreen is not a substitute for other sun protective behaviors. I do think sunscreen sometimes tends to give people a false sense of security that I put on my sunscreen, I'm going to go out and lay out in the sun all day. And that's really not what it's intended for. It's intended to protect you from sunburn and from UV damage, but it is not a substitute for other practices like seeking the shade and wearing sun protective clothing, broad-brimmed hats, sunglasses to protect your eyes. You can get ocular melanoma, so you want to be aware of that. And seeking the shade, covering up, all those good things. I will say that for people who are concerned about the potential risk from chemical filters, be it environmentally or whether or not it's found in the bloodstream, and they have found chemical filters in the bloodstream in certain studies, stick with physical blockers. They are getting better and better all the time. I myself have switched more to zinc and titanium based sunscreens. I still use chemical sunscreens on myself, only physical sunscreens on my children, but I have switched more even for my own protection and just said I'm okay with the slight white cast and I'm going to go for a more physical blocker. So like I said, some protective behaviors, seek the shade, broad-brimmed hat, sunglasses, sun protective clothing. I love they sell nowadays, they're quite common, these like long sleeve rash guards, like what surfers might wear. So you can get those, you can buy them on Amazon, Walmart, Costco. Oftentimes you can find these sorts of things at CVS. So they're pretty broadly available. You can also monitor the UV index to better understand your risk in real time. So UV indexes primarily measures UVB and not UVA. So there's some nuance to this, but in general, if you have a smartphone or an Apple Watch and you go to the weather app, you will see all the temperature. And then when you scale down on it, it will say UV index. It goes from 0, in the dead of night, up at 2 o'clock on a July day like today, it's going to be around 10 or even 11. And typically what I tell patients is if it's 0, 1, or 2, you're probably fine going out for a walk without anything, without any protection. If it's 3 or higher, that's when you want to protect yourself. And you will notice that the UV index is higher in July than it is in January because of the tilt of the Earth and this hemisphere and where we're getting, how much direct penetration we're getting of UV radiation. So it can just be a helpful thing to keep in mind when you're wanting to know your own risk. I recommend getting vitamin D safely. Vitamin D is extremely important and has lots of functions that you should be aware of, but chasing a tan to get vitamin D, especially as we get older, unfortunately, our bodies are less efficient at converting the type of vitamin D that comes from the sun into usable vitamin D for your body. So, you could go out there and bake. If you're 70 years old, you're still, it's possible you can still be vitamin D deficient because your body's just not as efficient at it. So you want to be aware of that. Eat vitamin D rich foods. Lots of foods are fortified with vitamin D, or oily fish, eggs, things like that. Or take a vitamin D supplement, which are widely available over the counter. Okay, I'm going to do a little, still have time, so I'm going to do a little trivia, and you can either shout out your answer or you can put it in the chat, and I'll try to monitor. First question, true or false? All sunscreen protects you from sunburn, skin cancer, and aging or wrinkles, which we call photoaging. Is this true or is this false? All right, good. We've got at least a couple brave souls who are entering in false, and that is correct. Sorry, I went too fast on that. This is false. So sunscreen can only list that on the label. if it is SPF 15 or higher. You really do want to push for 30 or higher, I think, personally. But yeah, that SPF 8, it may protect you from sunburn. All sunscreens protect you from sunburn, but it cannot list on the label that it protects you from photoaging or skin cancer. How much sunscreen is enough to cover your entire body? Let's say you're going to the pool for the afternoon. You're going to put on your sunscreen. Do you need a teaspoon, a tablespoon, or a shot glass?
And while everyone's answering, it looks like the chat is disabled for participants, so please use the Q&A. That is active for all participants.
Okay, perfect. All right, good. So we've got a little smattering here, but it is answer C, a shot glass. So it's about 1.5 ounces to cover your entire body. Most of us, myself included, when they do the testing in these UV testing centers, when a sunscreen is going through, pre-market testing to allot that magical SPF number on it, the amount of sunscreen that they use is laughable compared to the amount that you and I use on an ordinary day. And so that's why I always think it is more helpful to push to the higher SPF rating. Because, if you applied it like they do in testing centers, an SPF 30 is great, even if you're out for, a really sunny afternoon. But we just don't do that. And so that SPF 30 probably is an SPF 30, and SPF 50 is probably more like SPF 35. So I do think in that respect, it's helpful to push to the higher numbers. True or false? You don't need to wear sunscreen when it's cloudy. Good, everyone is getting this one right. This is so false, okay? I'm sure all of us have a story of going out and thinking, it's not that sunny out, I'll skip it today. And then you come back in and your cheeks look all nice and pink. So sunscreen penetrates clouds, or sun penetrates clouds, especially UVA radiation, which is what causes brown spots and wrinkles and that sallow look of photoaging. So you have to wear it even on a cloudy day, really, unless it's true storm clouds and it's just about to rain. There's still a lot of UV radiation out there. Okay, sunscreen can be damaged or inactivated by heat. Is this true or false? This is true, okay? Especially for the chemical sunscreens like avobenzone, it is inactivated by UV radiation. So if you set your sunscreen right out there on your cabana and it's sitting in the sun all day, that's really gonna tank its effectiveness. So throw a shirt or a bag over it, cover it in some way. Zinc is a little bit less likely to be inactivated, but sunscreen should not be left out there to bake in the sun. Okay, spray sunscreen and lotion sunscreen are equally effective. Is this true or false? All right, I'm getting a smattering of different answers. This is a trick question. So this is true and false. I don't like spray sunscreen. Most dermatologists don't like spray sunscreen. I know it's really convenient. The issue is, it's not that spray sunscreen is inherently less effective than a lotion sunscreen, but it's so prone to user error. I have seen lots of patients who come in and they look like zebras. They spray and they get protection here and then none here, and then here and none here. And so they come in with this striped pattern from where they got the sunscreen on themselves and where they missed. So it's really hard to get an even effective application with the spray sunscreen. and also spray sunscreen, particularly for kids who cannot hold their breath during the application. It's really prone to inhalation, which I think is an issue. So I would never use spray sunscreen on kids. So lotion sunscreen is going to be your best bet, unless it's a spray to rub. So they have these, a couple brands have these spray lotions, but then you're having to rub it in anyways. You may as well just use a regular lotion sunscreen. The one area where I will say I sometimes recommend spray sunscreen is in patients with some decreased hair density on their scalp, but they're not bald. So they have enough hair that they can't rub a lotion over their scalp adequately without it feeling greasy and goopy, but they don't have enough hair to protect themselves. And so in those situations, I do think some spray right down on the scalp can be helpful. That is the last question, or last trivia. So I always end my presentation. These are my two little kiddos who are demonstrating good sunscreen use by wearing their hats when we were out on a hike recently up near Mount Diablo. And then this is some information on the left about our clinic sites. I have two partners, Dr. Albert Chu and Dr. Haley Latham. We all practice out of our Livermore site, which is the site on top. I also practice out of our San Ramon location, and Haley Latham also practices out of our Danville location. So just some information there for you. We see all types of patients, 12 and up. So I don't see the young kids, but we see a lot of adolescents and people all through their life spectrum. We see common, mundane things to very rare, extraordinary things. So please let us know how we can help. I see there's a couple of questions in the chat. Favorite and recommended sunscreen for babies and young children. So again, the brand is going to be less important than making sure that it's a mineral-based sunscreen. So something that contains just zinc and titanium. I like the brand Badger sunscreen. I use that on my own kids. I also like an Australian brand that you can buy on Amazon. It's called Blue Lizard. They have a good baby sunscreen. And I should say that just because a sunscreen says it's for pediatric patients, it doesn't mean that you can't use it. And oftentimes when people say, I don't like sunscreen because it makes me rashy or it makes me itchy, usually it's that they are reacting to one of the benzone components in the chemical filters. So those patients tend to do very well with physical blockers. And I always tell them, look for a baby sunscreen. Those are often the same formulation they use for sensitive skin. It's just a marketing thing that they put sensitive skin on one and baby on the other. So you can use those for yourself. If wearing a broad-brimmed hat that blocks direct sunlight, do you still need sunscreen? Great question. Yes, ideally you do. And the reason is because you're still getting reflective radiation, especially if you're near water or snow, something like that. So the hat is giving you some protection, but I think your best bet is double protection to combine those things together. And then I see another question in the chat about, does sunscreen expire? It does. The FDA passed a rule several years ago now about sunscreens. They have to be good for 3 years from the time of purchase, or list an expiration date if they're not good for that 3-year time period. So ideally, if you're using as much sunscreen as you should, then that bottle of sunscreen shouldn't last you longer than that anyways. But 3 years is a good bet. So you can always just take a Sharpie, write the date you purchased it on the bottle itself, and then you know how long it's good for. And I'm happy to take any other questions.
So we have a comment from Judy Lloyd, who is our chamber CEO in Danville. Yes, Judy, there are appointments with Dr. Latham in Danville on that slide there.
There you go. Yes, we are always taking new patients. So would be happy to see you.
Mhm.
With that, I will stop sharing my screen here.
Okay, well, thank you, Dr. Dickman. I'm listening to your presentation and I'm like checking myself out here and I'm, oh, you're making me very nervous.
That's not my goal. Make you empowered. That's the goal. Make you
I need-
empowered to know what to look for and take care of your own skin.
True, but I am not an expert and I do have, genetically, we have a lot of moles in our family. So I am overdue for my visit with my dermo to check all of those out. So regular checkups, right?
There you go.
Yep. Okay, so if there are no other questions or comments for Dr. Dickman, we will, oh, here's one last one coming in. Would adding makeup over sunscreen minimize its effectiveness?
Great question. No, you can feel free to put your makeup over the sunscreen. Sunscreen should go on your skin first, makeup on top. And I would just, if you're able to give yourself a 2-minute break in between applying sunscreen and applying makeup, that can help just so that you're not smudging it all around and it's had a second to settle.
Okay. Well, thank you very much. This has been very informative. I checked our weather app here and we're at a UV index of 9 today.
There you go. Wear your sunscreen.
There's the sunscreen. So everybody stay safe out there.
Yes.
This recording will be posted on our chamber websites for reference, along with all of the contact information from Dr. Dickman and the dermo practices for Stanford ValleyCare. So with that, everyone have a good day and please protect yourself. Thank you, Dr. Dickman. Thank you, Shelby.
Take care. Thanks for having me.
Thank you. Bye-bye.